If you are 38 weeks pregnant right now, take a deep breath with me, because this is a powerful moment. Your baby is fully developed. Your body has been preparing for this day since the very beginning. And yes, you are closer than ever to meeting the love of your life. Maybe your belly feels lower. Maybe you're feeling more pressure, more tightness, maybe even some contraction. And you're wondering, is it time? Am I ready? Is my baby ready? Let me tell you something that should bring peace to your heart. At 38 weeks, your baby is considered the lungs are ready, the organs are mature. Your little one can safely be born now. That is not something to fear, that is something to celebrate. In today's video, I'm going to explain exactly how your baby is developing right now, why your belly may have dropped, the difference between practice contractions and real labor, when to go to the hospital, and how to feel confident and calm about birth. But before we begin, I already count on your beautiful support. Please take 1 second and gently tap the like button. It helps this message reach other mamas who need reassurance. And if you're new here, subscribe to the channel and become part of our pregnancy family. Now go ahead and write in the comments, I am here, 38 weeks, and tell me how you're feeling. You were created for this moment. Let's talk about week 38. At 38 weeks of pregnancy, your baby is no longer in the stage of almost ready. Your baby is ready. This is a full-term pregnancy, which means your little one has completed the essential phases of development inside the womb. The lungs are mature, the brain is functioning beautifully, and the heart is strong and steady. One of the biggest concerns for many mothers is lung development, but by 38 weeks, the surfactant in your baby's lungs is fully present, allowing those tiny air sacs to expand properly after birth. This means your baby can take that first breath independently. The digestive system is prepared to process milk. The sucking and swallowing reflexes are coordinated. The immune system has received antibodies from you, providing important early protection. If your baby is born now, medical professionals consider this a safe, ideal time. There is typically no need for NICU support in a healthy pregnancy. This is a powerful reassurance. Your baby is prepared for the outside world. Right now, inside your womb, your baby's body is working in harmony. The nervous system is refined enough to regulate breathing, temperature, and feeding reflexes after birth. This level of maturity is extraordinary. Your baby's brain continues developing, but the structures necessary for survival are already complete. The coordination between the lungs, heart, and brain is established. Even the baby's skin it is smoother, filled out with fat stores that help regulate body temperature once born. That adorable softness has a biological purpose. Everything happening now is not about survival anymore. It's about preparation for transition. Your baby is not fragile at this stage. Your baby is strong. Many mothers feel anxious about what if the baby comes early. But at 38 weeks, this is not considered early. This is full term. This is nature's timing window. The placenta has done its job beautifully. It has nourished your baby for months, delivering oxygen and nutrients. Now, your baby is capable of taking over those responsibilities independently. The body systems are synchronized. Breathing, circulation, and digestion are ready to activate the moment your baby is born. Instead of fear, allow yourself to feel anticipation. Your body and your baby have reached a milestone that millions of years of human biology have perfected. Your baby already has eyelashes, eyebrows, fingerprints, and possibly hair. These details are not just cosmetic. They signal complete development. The eyes can open and close. Your baby can respond to light and sound. They recognize your voice. The hearing is well developed. If you speak, your baby reacts. If you play music, your baby can perceive rhythm. You are not carrying a fragile being anymore. You are carrying a fully formed human ready to meet you. At this stage, weight gain in your baby primarily supports energy reserves for birth. Those little fat layers are intentional. Birth requires effort from the baby as well. The stored fat helps regulate body temperature and provide energy in the first hours of life. The immune transfer from you to your baby peaks during these final weeks. Your body is giving one last powerful gift of protection. There is something deeply reassuring about knowing that nature has timed this perfect. At 38 weeks, your baby's reflexes, grasping, sucking, blinking, are coordinated. These reflexes are survival tools. They are not random movement. They are preparation. The cardiovascular system is ready to shift from placental oxygenation to lung oxygen. This transition is one of the most remarkable processes in human physiology. Even your baby's sleep cycles are formed. There are periods of active sleep and quiet sleep, similar to what will continue after birth. The womb has been a training ground. Now the outside world becomes the next chapter. And as you approach delivery, remember, you are not waiting for readiness, and you are waiting for timing. At 38 weeks, the average baby measures about 47 centimeters and weighs close to 3 kilograms. But averages are not rule. They are reference. Some babies are smaller, some are larger. Both can be completely healthy. Genetics, maternal body type, nutrition, and placental function all influence size. Healthy does not mean identical. It means well-functioned. Ultrasound estimates are just that, estimate. There can be variations in measurement. A baby measuring slightly below average is not automatically underdeveloped. Likewise, a larger baby does not automatically mean complication. Your provider looks at patterns, not isolated numbers. Growth curves are tools to observe trends over time. A consistent pattern matters more than a single measurement. Your baby's growth has been monitored throughout pregnancy. Trust the longitudinal story of development, not a single statistic. Your body has been nourishing your baby exactly as needed. Comparisons can create unnecessary anxiety. Every pregnancy journey is unique. Two mothers at 38 weeks may carry very differently. One may look small and deliver a healthy 3.2 kilograms baby. Another may look larger and deliver a 2.9 kilograms baby. External appearance is not a reliable indicator of internal health. Your baby's weight is influenced by genetics from both parents. Birth size often runs in families. The placenta regulates nutrient delivery intelligently. Even if your baby is slightly under 3 kilograms, this can still fall within normal parameters. Medical teams evaluate overall health, heart rate, fluid levels, and movement, not just weight. Healthy babies are defined by function, not by fitting perfectly into an average chart. Your baby is growing exactly in alignment with their biological blueprint. Trust that growth is individual, not competitive. Since early pregnancy, the hormone relaxin has been gradually softening your ligament. This process was subtle at first. Now, at 38 weeks, its effects are more noticeable. Your pelvis feels looser because it is becoming more adaptable. Pelvic discomfort is not dysfunction, it is preparation. The joints of your pelvis slightly separate to allow passage of your baby's head. This flexibility is intentional and biologically intelligent. Your body has been rehearsing for this moment for months. You may feel instability when walking or turning in bed. These sensations can feel alarming, but they are signs of structural readiness. Your skeletal system is participating in birth preparation. Lower back pain results from the shift in center of gravity. The pelvic floor is carrying increased weight. The uterus, placenta, and amniotic fluid all contribute to downward pressure. Your body is not failing you. It is aligning for delivery. Every ache has purpose. Every sensation reflects transformation. You were biologically designed for this process. If your belly appears lower, this is called lightening. It means your baby's head has engaged in the pelvis. This often happens between 36 and 38 weeks. It is a sign of readiness. With engagement, pressure shifts downward. You may breathe easy. Heartburn often improves. Your diaphragm has more room. Pelvic pressure increases because your baby is positioning for birth. The cervix begins subtle changes. Walking may feel heavier. Frequent urination may increase. These are not problems. They are progress markers. Your baby is aligning with your birth canal. This is the body's choreography before labor. Sharp sensations in the pelvis are common at 38 weeks. They are sometimes called lightening crotch. These occur when the baby's head presses on nerves. They are brief but intense. Groin discomfort reflects increased pelvic floor stress. Your baby is heavier now. Gravity adds to the sensation. This is mechanical, not pathological. Turning in bed may trigger sharp pains. Standing up from sitting may cause pressure. These are related to ligament stress. Your pelvic floor muscles are adapting. The uterus weighs significantly more than earlier in pregnancy. Combined with placenta and fluid, the load increases. Support belts, rest, and slow movement can help. Discomfort does not equal danger. It equals preparation. At 38 weeks, you may notice your belly tightening from time to time. These are called Braxton Hicks contractions, also known as practice contractions. They are your uterus rehearsing for the big day. Unlike real labor contractions, these tightenings are irregular. They may feel uncomfortable, but they are usually not intensely. They are temporary and unpredictable. Your uterus is a muscle, and like any muscle, it benefits from preparation. These contractions help tone and strengthen. Instead of fearing them, try to see them as your body warming up for birth. Braxton Hicks contractions often improve when you change position. If you walk, rest, hydrate, or take a warm shower, they may ease or disappear. This is one of the key differences between practice contractions and true labor. Practice contractions respond to comfort methods. They are not progressive. They do not become stronger and closer together in a consistent pattern. They are your body's way of saying, "We are getting ready." Some women feel them daily, others barely notice them at all. Both experiences are normal. Having frequent Braxton Hicks does not mean labor is imminent. And not having them does not mean your body is unprepared. Your uterus is intelligent. It prepares in different ways for different women. There is no single correct pattern. These contractions increase blood flow to the placenta. They help the cervix begin softening gradually. They allow you to become familiar with uterine tightening sensation. They reduce anxiety by introducing you to what contractions feel like. Some studies suggest women who experience more practice contractions may have shorter active labor phases. However, even women who never feel Braxton's can have smooth births. The key message is this: your body is preparing in its own rhythm. Trust the process unfolding. Each tightening is rehearsed, not emergency. You are moving closer to meeting your baby. True labor contractions are different. They are rhythmic, progressive, and they do not stop when you walk. They do not disappear when you hydrate. Instead, they grow stronger, longer, and closer together over time. This progression is the defining feature of labor. In early labor, contractions may start 10 to 15 minutes apart. Gradually, they move closer together every 7 minutes, then every 5 minutes. The intensity increases steadily. You may find it harder to talk through them. Unlike Braxton Hicks, true labor contractions create cervical. They are not just tightening, they are opening the cervix. This is why they feel more intense. There is purpose behind the discomfort. Labor typically moves through phases: prodromal, latent, active, and transition. During prodromal labor, contractions may feel strong but irregular. In latent labor, dilation begins slowly. Active labor usually begins when contractions are about 5 minutes apart and dilation reaches around 6 centimeters. This is often when healthcare providers recommend going to the hospital. Understanding these stages reduces panic. You are not expected to guess. You are expected to observe patterns. Timing contractions brings clarity. Knowledge replaces fear. When the pattern becomes consistent and progressive, that is your sign. Labor is not one sudden event. It unfolds gradually. The first phase often begins gently. You may still be able to talk, eat, rest, or shower. This stage allows you to conserve energy. The latent phase can last hours, especially for first-time mothers. This does not mean something is wrong. It means your body is opening slowly and safely. Birth is a process, not a race. When active labor begins, contractions intensify. They require focus and breathing. You may feel the need to lean inward, concentrating. This is your body shifting into serious work. Transition is the most intense stage, but also the shortest. It signals that birth is very near. Each stage has purpose. Each phase moves you closer to meeting your baby. Knowing what to expect reduces shock. You are not losing control. Your body is taking control. Your uterus contracts with coordinated strength. Your cervix opens gradually, like a flower unfolding. You can move through labor one contraction at a time, step by step, breath by breath. If your water breaks, it is important to contact your provider or go to the hospital. Amniotic fluid protects your baby. Once membranes rupture, infection risk gradually increases. Medical monitoring becomes important. The fluid may come as a large gush or a slow trickle. It is usually clear or pale. If it is green or brown, medical evaluation is urgent. Color provides information. Vaginal bleeding, beyond light spotting, should always be assessed. Bright red bleeding is not something to ignore. It requires immediate medical attention. Your safety comes first. Even if you have no contractions yet, ruptured membranes require monitoring. Healthcare professionals will assess your baby's heart rate. They will evaluate cervical progress. They may recommend induction if labor does not begin naturally. This is not something it is something to manage safely. You are not overreacting by seeking care. You are protecting your baby. Prompt action brings peace of mind. Hospitals are prepared for this moment. At 38 weeks, your baby is ready. From the very beginning of pregnancy, your body began preparing for birth. Hormones shifted, ligaments softened, the uterus grew with remarkable precision. Nothing about this process is accidental. Relaxin has loosened your pelvis gradually. Oxytocin receptors have increased in your uterus. Your cervix has been softening silently. Your body has been working long before labor began. Fear is natural, but biology is powerful. Women have been giving birth for thousands of years. Your body carries that same blueprint. You are part of that lineage. Whether you choose vaginal birth, cesarean, medicated, unmedicated, hospital, or home birth, your strength remains. There is no less than way to give birth. Safety and informed choice are what matter most. Your body and your medical team will work together. You are not alone in this process. Your baby knows what to do. Your uterus knows what to do. Your hormones know what to do. Trust does not remove intensity, but it replaces. You were made for this moment, and you are closer than ever to holding your baby.